Let's clarify some questions regarding the gallstones, right? So gallstones or pitta, which you called it in Punjabi, they are the stones in the gallbladder. So why this happens? Because there is an inflammation in the gallbladder. It helps in accumulation or concentration of bile. That bile get converted into solidified form or called stones. So basically the inflammation of the gallbladder will lead to, or a lot of time, even the deposition of cholesterol. So patients having hyperlipidemia or high cholesterol for a long period of time can also have gallstones. The risk factors other which used to be mentioned were a patient who has lost a lot of weight, a patient who is obese, after the age of 40 it was common, females were having more common stones than males. These were all risk factors as quoted in the books. But latest when you see the patients, there are patients who are very lean, thin, have never gained weight or never lost much of weight, still they have gallstones. So you never know. So how to rule those out? If your clinical symptoms includes your bloating or your indigestion for long period of time, or if you take a heavy fatty meal and you are not able to digest it properly, or your stools have fat, these could be the symptoms of the gallstones. Get your ultrasound done. Abdomen ultrasound, it will help you detect the gallstones. So there are questions people ask. First question was asked that are gallstones reversible? No, they are not reversible. There are certain drugs like Udiliv or certain Ayurvedic or whatever homeopathic drugs. No, nothing can really work. Udiliv has worked in a very small stone when taken for more than an year, and that too in very rare or very few patients. Most of the patients do not reverse their gallstones. Second thing, why not we remove only the stones, and why do we need a surgical total cholecystectomy or the removal of the gallbladder along with the stones? Because when there is inflammation, even if we remove gallstones alone, there is high chances it will again develop, that too in few days only. It might not even take years then to develop those stones again, because inflammation does not go away that easily. Another question was like kidney stones, right? There is a mechanism we break that. That's called lithotripsy. That does not work with gallstones. Why? First, the location of the gallbladder. Secondly, the smaller the gallstone, more dangerous it could be. Larger stones will stay in gallbladder. Gallbladder is like a small pocket, so it might stay there only. Smaller stones can migrate and go to the CBD or the common bile duct, where it will obstruct that duct, and that duct, when it is obstructed, can cause jaundice. It can obstruct the pancreatic duct, causing acute pancreatitis. Acute pancreatitis is a life-threatening emergency. It is very dangerous. It can get stuck. So if it is that gallstone, if you do not get treated, or that is surgical removal of the gallbladder, if you do not get that done on time, if it gets complicated or the stone moves to any of the duct, it can be extremely serious, and then it's a complicated situation, because then surgery also cannot be done immediately. Then you will need ERCP, which is a procedure in which we remove the stone, we put up a stent, so we dilate it so that it normalized, to give it a few weeks to normalize, and then we again remove that stent, and then we do the surgery. So it becomes basically 3 to 4 step a procedure, which is a complicated one, painful, life-threatening, obviously costly, and of course costly on your health as well. So best is if you get tested or diagnosed with gallstones, get yourself surgery done. There's no point waiting for it. And when gallbladder is removed, so people do ask what would be the changes in the lifestyle. Initial 1 week or 2 weeks, you might feel a bit of frequent defecation or passing of bit of loose stools, but it will be okay after that. There are no future symptoms unless until you are eating like anything, you are taking too much of fats, then of course it won't be digested, because bile is formed by liver. So that bile is directly going into the your intestine, small intestine now. So it's of course digesting the fats, but the concentration is less now. So normal food, normal healthy diet, no effect at all. No effect on your weight, no effect on your appetite, nothing at all. So of course, if you get tested, if you get diagnosed with cholelithiasis or cholecystitis, just go and get yourself surgically removed, and do get a biopsy out of that, because it can, in long term, if they are having this, there is a high chance it can also convert into a cancerous or a tumorous form. So just get it biopsied after getting it removed. Do not miss that, and do not worry about if it has happened. It's quite common, even small children are getting it. So surgery also, these days laparoscopic surgeries, they are very quick. You're getting discharged after 24 hours. Recovery is very good, so just get that treated. There might be symptoms of neurological pain as well because of the gallstones. So there might be a lot of symptoms. If you are feeling any stomach related issues for a long time, bloating, gastritis, or indigestion or fat in the stools, all these symptoms could be of that. So just get yourself checked first, followed by the treatment is very important. Do not ignore it, and do not think can be reversed by any desi dawai or anything. No, it does not. And the only treatment is the surgical removal. Do not ignore that. Thank you so much. Like, share and comment, and do subscribe to my YouTube channel. Thank you so much. Feel free to ask the questions. Thank you.